Hi, I'm Dr. Peters with Peters Wellness Chiropractic and Massage. This week's quick video, I'd like to discuss extremity adjusting. So what is an extremity? An extremity is a joint that is not part of the spine itself. So thinking about it from the ground up, you go with the foot or foot and ankle, the knee, and then coming up into the hip. Mainly when we talk about the hip, would be the ball and socket of the femur and the acetabulum, whereas when you get into the pelvis, that is considered part of the spine. And then coming up into the upper extremity, we have the hand, wrist, elbow, and shoulder. And included with the shoulder would be the clavicle, where it goes from the sternum out until the shoulder blade or the acromion process. So what I'd really like to touch base on, because I adjust extremities on my patients, I like to basically start to ground up with the foot. And the reason why, if you look at the foot, the anatomy of it, there are 26 bones in each foot. And if you look at the count of the bones in the body, you're looking at 25% of the bones of the body are in your feet. So that's feet combined, left and right. But 25% of the bones in your body are in your feet. And, you know, somebody will say, well, I sit at my desk all day. Well, unless you're in a wheelchair or something, you're still having to get up and move. You got to get up and get in the shower. You got to get up and make breakfast. You got to get up and walk to your car. You may sit in your car for an hour, but then you got to walk from your car to your office. And so we are on our feet a lot. And what's really cool nowadays is our phones have pedometers built into them. You can get the little, wristbands that communicate. So if you don't have your phone on you, it's still communicating. But in looking at the foot, I have a model here. So if we look at it, this is a model of a right foot, and coming down from the leg, we have the tibia and the fibula. So the tibia is basically the shin bone, the larger bone, and then the fibula. Well, if the foot biomechanically isn't moving properly, what will happen is it cause joints to jam and not move properly, and that can cause a lot of knee issues. So, foot, ankle, and knee issues, especially with working with team and training, looking at the runners, a lot of these people are running to raise money for someone they love or love and care for that had some type of lymphoma or leukemia. And a lot of them aren't necessarily runners, but now they've become runners. So being able to help them do that, something they're passionate about and excited about, hopefully without getting any kind of stress fractures or anything like that, as they're running more and more miles every week. So if you're having, or if you know somebody who's having foot or knee issues or hip issues, or carpal tunnel type syndrome, different symptoms like that, or tennis elbow or golfer's elbow or medial lateral epicondylitis, whatever you want to call it, whatever term you want to put on it, we can check all those joints and make sure they're moving properly. And if they're not, a lot of times when you get them moving properly, the pain will subside, because proper function leads to reduced pain. So if you or someone you know or love is suffering from extremity issues, please have them come in and get checked. If you're not in this area, just find a chiropractor who adjusts extremities. Some chiropractors don't. A lot of chiropractors only adjust upper cervical. I'm a head-to-toe chiropractor. I adjust any joint that I find is subluxated, and that's my passion. That's what I love to do. So if you know anyone we can help, or if you have any questions, please contact us. That's it for this week. Thanks a lot.